from 108 hands-on batch. I am the monitor of 108 hands-on batch. I am Dr. Seema Madan from Faridabad, and I have a question for sir. Sir, if I am registered at level 2 ART clinic, but I don't have my OPD there, can I still stimulate my patient and take them there? It's regarding the ART law.
Absolutely. What happens is that you have your own little OPD, a small OPD of your own, like a level 1 OPD you may be having, where you do your routine infertility practice, and this is the level 2 clinic. It's a big IVF clinic. So you are working here, you are registered at your own OPD, which is the level 1 clinic.
So I have to register for level 1 also?
Otherwise you can't use hormones.
Or otherwise I do the OPD at level 2 only?
Yes, once you have got a 50 OPUs and 3 years criteria being met, then you have to see your OPD here only. You have to see your OPD somewhere.
Yeah.
So in case you are seeing OPD at your home or a personal OPD, this is what you meant? Here this OPD has to be level 1 OPD.
Okay.
Because otherwise you cannot start gonadotropins. And here also when you start, you should be primarily seeing your OPDs in level 2 clinic only. Your name should be there on the board. You should be having your name should be on the roll of that particular hospital. And you should have your OPD chamber there. You should have PCPNDT there, and medical council or your maybe UP council certificate. Haryana council should be there. Fine, it should be hung there. Now you should be seeing OPD here, but you have your own OPD somewhere outside where you are seeing evening OPDs. Because these OPDs they shut down, level 2 shut down by evening 4 o'clock or 5 o'clock. Right after that, काम खत्म हो जाता है ना यहाँ पर. So then they are daycare ones. So now when you go back to your OPD in the evening, these patients may come to your OPD, but this OPD should be level 1 because otherwise you cannot stimulate from here.
Okay.
So you write that I am so and so, your name should be there. You write patient listed for this particular OPD, this particular center, and you can start the stimulation here.
And the level 1 OPD is only for registration. I may not be doing IUI there. I may be doing IUI also at the level 2 center.
That's fine. But in case you want to see, that applies to me also. That applies to me also. I may not do my IUIs in my level 1 OPD. I have a level 1 OPD. I don't do. This center is my level 1, but I don't do. I don't do IUIs here. But in case I want to, my patients come from level 2 आ जाते हैं दिखाने के लिए. I have to write gonadotropins from them, na. At least I say I am working at that hospital. I am registered there officially. But to write any gonadotropins, I have to be having level 1.
Okay.
Otherwise, you cannot write gonadotropins. That's the problem.
Yes.
Or the good thing. Is it clear?
Yes, sir.
So wherever you are working in a small OPD, that should be minimum level 1 OPD in case you want to start stimulation for IUI or IVF. In case you are doing plain simple OI with time intercourse, you may escape for some time. But government has not made any typical clause for that. But remember that, you are using drugs there.
Yeah.
So you are supposed, as per one of the RTI's responses, wherever you use gonadotropins, you have to be level 1. So, but you say I am doing, but level 1 is for IUI. Level is for, you say I am not doing an IUI.
Yeah.
I am only given HCG and they are having time intercourse. Government will say, okay, smart, go ahead. But when you start doing it repeatedly, at some point of time, you will be having problem. But ensure that you don't play smart. They are doing time intercourse and do IUI at some other place. So that shouldn't happen. TI means a TI. Is that okay?
Yes.
Thank you.